I welcome you all to this marathon series. Today we are live for Pediatric marathon, and I welcome you all. And first of all, I'd like to apologize for this long break. January, we did not do any live sessions. The only reason for that was January was my anniversary, my birthday, and then I was off for a spiritual break to the Mahakumbh and everything. So that 1 month I could not, for the January I did not do anything. But I'm going to make it up for in February, in March. In coming months we are going to do really good sessions. And for today's session we have with us none other than a very good friend and a very knowledgeable friend, I'd rather say. She is Dr. Rukshin Master. Obviously, by the name you know, she's daughter of Dr. Farooq Master, but she has been a very good pediatrician right from the beginning. Since the days I've known her, she had a special interest. She's done her MD in pediatrics. She's done her PhD in autism. She's a wonderful prescriber. So I want you all to, I'll just send her a friend request so that she's here to join with us. Your request on Rukshin Master, your page. I don't know. The immunity doctor doesn't come. In case if you can see me. So till the time Dr. Rukshin is joining us, what you all can do is start thinking about what are the questions that we are going to cover, what are the topics in pediatrics that we are going to cover up. In case if I'm missing out on something, Rukshin, if you're trying to do it from your laptop, it won't happen. So I've sent you a request, I've sent you a link for your reference. I hope you all were doing well. Yeah, immunity doctor joined. Yep, you should be there on the screen, Roshi. Hi,
Hi, how are you?
I'm fine. How are you?
Good.
Long time.
Thanks for having me on.
Yeah. No, it is totally our pleasure. And I would like to introduce you to a lot of my friends who are there on Instagram. And maybe we have a lot of common friends, but there are some students who we have regularly been attending these sessions. And I think more and more will join in soon. I hope you're doing well.
Yes, thank you. Just one thing, I can't see your video, so I don't know if others can see your video.
No,
So,
I think this is a new glitch that has come up with my Instagram thing that
oh,
the person who joins cannot see me, but I can see you, and people also can see both of us, but my
okay,
guest
then that's
cannot see
perfect.
me.
Ah,
Yeah,
okay. Okay, fine.
I don't know what's wrong with this Instagram thing, and it's very. I know a lot of guests have complained that it's very awkward for us, Abhishek, to talk at the blank screen. Guys, I think Rukshin's screen is freezing. Yeah, I think there was some network
Yes,
problem. Yeah. So what I was saying, that I know it's a very awkward situation where the guest has to talk in the screen where they cannot see me, but
I know.
trust me, we everybody can see all of both of us, and I can see you. And I
Excuse, that's
think,
it.
yeah, I'm sorry. I'm sorry. I didn't hear that.
No, I'm saying I won't be able to interpret your facial cues, but
No, no,
otherwise we're
no.
good.
No. So I was just telling all our friends that uh, from the beginning I've seen you doing having a special interest in pediatric practices. Your pediatric practice has been really, really very influencing, and we've seen you practicing right from the beginning since your internship days, and initially, obviously, with the guidance of Dr. Farooq Master sir, and now you're doing so well in Singapore. So I think we are good to start. And also I'll just tell my friends that Dr. Rukshin's voice has a problem, so maybe we'll take a break in between. So please don't mind. She was extremely unwell, and still she could have chosen to deny, but we are really grateful that she has given her time to us.
Thank you. Thank you so much. Yes, sorry, my throat catches up every now and then when I talk too much. So I might be taking a little more breaks than I should be, but I think it'll be a fun session. So I'm excited to get things started.
Yeah.
Um,
So, Rukshin, to start with, can we start with something which we all were very fascinated in HHC, like HHC is Homeopathic Health Center, Dr. Farooq Master's clinic. We call it as HHC for the future, for the further reference for next 1 hour, we'll call it HHC. So HHC में सबसे important चीज was TCC and COW. When one enters, one sees so much TCC, and then how did you come to TCC's tendency to catch cold
correct.
for our audience. So what was your approach for TCC? How did you get introduced to, like, because sir sees so many cases of TCC, like we have like tons and tons of cases.
I agree. I agree. And I feel like, honestly, TCC, this change of weather, situation, allergic conditions is bread and butter for almost all of us homeopaths. So it becomes very, very important, just even when you're starting out your practice, to master that little part of it. Because even when I came to Singapore, I was amazed to see that the amount of children that are suffering with just basic complaints of, recurrently falling sick every now and then, recurrently falling sick. They'll go to the pool and they'll catch a cold, or they'll go to a birthday party, have a pastry, and they'll get a cough. And unfortunately, the reason why I got into pediatrics and started doing my MD in it, and always knew that this was the direction I wanted to take, was because even at the clinic in that time, I used to see these people coming in with tinku kids, maybe 4-year-old, 3-year-olds, and their files would be this big because they would have gone from pediatrician, eventually to specialist, eventually to pulmonologist, being put on nebulizers, being put on inhalers. And it was honestly heartbreaking more than anything, because it's such a simple thing to treat, which now me and you know as homeopaths, and I'm sure a lot of the students see it themselves as well, that these are things which, simple remedies like tuberculinum, like carcinosin, like medurinum, will immediately turn the case around within 2 or 3 months, and this child will get much better. So I feel like this was a very big driving force for me, just because it's such a complaint that every single parent, and me myself with my daughter, faced till she turned 5. Every time there was a new bug circulating around the school, she would land up getting something or the other every now and then. And to be able to treat that with homeopathy, I feel is such a boon and a benefit for children, because it does not allow them then to fall sick so often and get such recurrent episodes like the other kids are getting in school. And at the same time, we're boosting up their immune system while we're doing that. So I feel like TCC is something we as homeopaths need to, all of us need to know how to kind of work around.
So in cases of TCC, what usually what we were taught when we entered clinic was that we have to there's a lot of education that comes with TCC. You have to actually educate the parents that if you keep on like because we get now in my now, when we were there in HHC like initial years and now in our practices also we see that patients come with this big file and the parents are taking twice a month to the pediatrician and giving antibiotics and ultimately landing up with nebulization and up to the extent of taking pumps and everything. So you have to educate them that once you start with the homeopathy, this is not some magical potion that we are giving them. And once you start with it, the spacing out will increase. Once if the child was falling sick twice a month, it will become like once in 15 days to 3 weeks to 4 weeks to 6 weeks. And ultimately, it will be a situation where the child will fall sick and will be on an auto healing session. लेकिन नाउ देन दिस के हाँ डॉक्टर साहब अभी सर्दी खांसी होता है लेकिन अभी 24 घंटे में ही ठीक हो जाता है तो ये अच्छा है अभी so ultimately it's the big thing that you can conquer and as she rightly said that we need to make this as our bread and butter because अगर ये हो गया तो सब हो जाएगा अगर ये नहीं हुआ तो कुछ नहीं होगा.
Correct. No, and this is like a building block for a child's immune system. I feel like if you screw it up here, that's when you're actually predisposing this child to then get sicker and sicker later in life because this child now already has had so many paracetamols, so many ibuprofens, so many ibuprofens, so many inhalers, and eventually their immune system keeps dropping with every time these medications are going in, and they are having some or the other bad effect on this child's system. So I feel like this becomes such an important building block, and you're very right with this whole education bit. And in fact, coming to Singapore, I feel like I have landed up doing it even more because, of course, I can give a lot more time to every patient as compared to what y'all can give back in India. But but just sitting with them, and I feel like the first thing which you need to educate them about as to why this is happening because we're so indoctrinated with the fact that sickness is bad, disease is bad, symptoms are bad, infections are bad, all the bacteria, viruses surrounding us are bad. I feel like education has to start from there to explain to the patient just a very simple thing that this cold, cough, fever that your child is having is simply a manifestation of what the body is trying to speak. Symptoms
Exactly.
are the language of the body, right? So when the body is trying to communicate with you, it's going to express itself as these symptoms. For example, there's an infection, there's an allergen, something that's entered this child's system. This child is not feeling too well. The first symptom will be what? Most likely a sneezing, a runny nose, start off with a cough. Now, this runny nose, this sneezing, what is it? It's the body's way of actually trying to eliminate as the first defense mechanism that this child has. So even our nose discharges, like the runny nose which this child has certain enzymes like lysozymes, which are all antibiotic in nature. So what they do is they immediately start discharging to kill whatever it is that's circulating inside your system and eliminate it outside the body. But our first response as parents is to give an antihistamine to stop that discharge, to stop that sneezing, let it remain inside. So simple things like this need to be taught. And once that outlook and once that whole, perception of what a disease is, what a symptom is changes, automatically parents are very much on board and on line with what you're trying to do with this child.
Exactly. So coming to the very main part, Rukshin, where everybody is very interested is that apart from antibiotic, apart from if not constitutional prescription, sir, अभी बताना चालू करो, मैम अभी बताना चालू करो कि क्या help करने वाला है. So
Okay.
I'll tell you. Can you please start with something like what apart from now what we are talking about is apart from constitutional prescribing because what is the main role is constitutional prescribing. There's no alternative to that.
I
But
agree.
in between, what is that gap that will be filled in between? So
Okay.
what remedies would you suggest?
Okay, so I'll tell you. So again, you're right. I use mostly a constitutional approach for these kind of complaints. But very importantly, what I advise them is that every time this child will fall sick is when we will pivot and take a acute protocol. And that's even more important to follow than the constitutional treatment that we're doing when this child is feeling okay. So it becomes very important to kind of balance and support constitutional treatment with acute treatment when the symptoms come on. Besides that, I feel like with kids, I'll end up using a lot of different kinds of remedies based on, if they give me any kind of particular indication. So, for example, out here, if I feel like, there has been some damage or something that's kind of got triggered after a vaccine injury, or, the child took a particular vaccine and, then developed the symptoms. So, I have the Helios remedies of every
Yeah.
particular vaccine. And so I would like to use that also sometimes, even as a starting remedy, just to make sure that we're, kind of covering that layer as well. And then start off with the constitutional treatment. Sorry.
No. Please be very comfortable, and whenever you
Yeah,
feel like, please
sorry.
take a break.
Yeah, no. And so another thing that I like to do also side by side is use nozodes. And so I will end up using a lot of different nozodes, which we can probably even discuss when we're talking about allergies. But I do like to, for example, if this child is getting a recurrent cold and cough and the mother feels, it's because of any particular kind of trigger, then I will try to see if I can find that kind of a nosode to use. For example, whether it be histamine, whether it be dust mites, whether it be house dust mites, whether it be house dust, things like that,
Yeah.
just to kind of, give intercurrently in these situations to make sure that this child is not so vulnerable. Then another remedy I'll end up using is chlorim a lot. So especially if the mother says, that this child gets cold and cough every single time this child goes into a swimming pool. And so chlorim 200 before swimming and after swimming, 4 pills each is something I would advise the patient.
Okay, that
So
is
simple
really
things like
something
that.
new for us.
Yeah.
Yeah,
Yeah.
so obviously, there is definitely we have then the acute exposure remedies like aconite and rumix and a lot of things as and when it is indicated and as in what like whatever comes up in the picture. But the definitely most important remedies would be constitutional prescribing, where most of the times it is tuberculinum, calcarea fos, and medorinum kind of remedies, or sorinum, or maybe as you rightly said, if it's the beginning of the case and where we know that the biggest culprit during this age group is going to be vaccination. So and countering it with neutralizing these vaccines, maybe we can use these vaccines as vaccines in potentized form, giving some remedies of in potentized forms of these vaccines, and then maybe starting off with our constitutional prescribing. It really helps a lot.
Yeah, and I also like to use tuberculinum even otherwise, even if the constitutional remedy is something else. A tuberculinum aviare is what I would like
Yeah.
to sometimes use in a 30C or a 200C every now and then, especially, if this child is a child that tends to develop a lot of bronchial complaints every now and then. And so, as an intercurrent dose, I will use the tuberculinum, even if the child is on a carcinosin or any other prescription for the constitutional remedy.
Tubercularium aviare, I think this is one of the most magical remedies that we have learned from Sir. So, because
Correct.
if I can quote a case here of Farooq Master Sir, I remember very well one of a very honorable homeopath. I remember the granddaughter had a very bad cough. Like she was like, I think, 45 days old, and they said nothing is working, no pediatrician is helping, and the saturation started dropping, and the saturation of the 45-year-old baby, 45-day-old baby used to drop up as low as 88 and 86. Sir said, I can only do, because if you, they had come out from, they were not from Mumbai, so they flew down to Mumbai with the baby. Sir said, I can do it only if you if you can't go back, you have to stay here for 2-3 days, and then I'll monitor, like he usually prefers doing. And then he said, tab aviare. And I was there in that case, and we saw a magical, like in 24 hours, the whole chest congestion was gone. Then there was no drop of saturation, and it was a wonderful prescription. So tub aviare is definitely one of these magical remedies which can bring out from the child from a very bad condition.
I agree. I agree. But even I feel like even in the kind of cases which I see which are not so complex, always remembering this remedy at the back of your mind is always a good
Yes.
idea in any
Yeah,
kind of
yeah.
cases which that tend to develop into these asthmatic kind of
Yeah,
conditions.
yeah.
So yeah.
Rukshin, can you highlight something about allergies? Like what comes to your practice very frequently when you are dealing with these allergic constitutions?
Okay, so allergies is actually a huge problem in Singapore, even though I feel like Singapore has a very pristine impression, that the air is clean and that this is clean and, everything is, absolutely immaculate. The allergic situation out here is unreal. So when I came, in fact, I was very shocked to see that their current eczema rates, for example, are 1 in every 5 child has eczema in Singapore, out of which 50% of those cases will go on to have eczema for the rest of their life because of just the sheer way that it's kind of being treated here with the steroid applications and things like that. But this is basically the state of allergies, and I feel like this is probably everywhere. But in Singapore, also, I'll end up seeing it very often. And for me, I see allergies, of course, at various different presentations. And again, that's very important when it comes to educating the parents, right? Because often what happens is that eczema leads to an asthma, and an asthma gets converted to a eczema, especially when they're on any kind of suppressive treatments. And parents don't even know that this is actually coming from the same kind of cause, which is the child which is suffering from allergies. So it's important to explain to them that this is the root cause of it, which is that your child is suffering from allergies. What it is, I like to talk about it also a little bit with them to explain to them that the immune system is kind of going into a hyperdrive. It's a very unnecessary increased response which the immune system is giving you because it feels very threatened by this particular allergen. And so the mast cells will keep releasing this histamine into the blood circulation, and then this can have different presentations. So some kids could probably develop a runny nose and a blocked nose. Some of them will develop adenoids. Some of them will develop swollen tonsils. Some of them will develop chest congestions and asthma. Some of them will develop gut issues. So they will have frequent, bowels, IBD, things like that. And some of them will develop it on the skin in the form of urticaria or in the form of eczema. And so all of these are just presentations that you're dealing with. But at the end of the day, you're working and going back to the same root cause of it. And so I feel like when you're working with that, it becomes important again to do a constitutional approach, in my opinion. And so I feel like, somewhere that gives you a little bit of a framework when you're working. Because generally, even though they are children, they will have enough symptoms for you to start off with. So even if I'm working with, let's say a 2-month-old child or a 6-month-old child, there are enough symptoms for you to kind of go back to and, repertorize and be able to at least start off with some remedy. But let's say in case you're not, and there's some remedies that you want to kind of just give based on completely what the symptoms are at that point of time, then in that case, some of the good remedies, as I said, are a lot of the nosodes that I use. So dust mite I'll end up using a lot because again, it's one of the most commonly seen allergen.
Commonly allergen.
Yes. So I would like to use it. So I do constitutional. Along with that, intercurrently, I will give a dust mite nosode. Most likely in the 200C potency is good for me. Very rarely will I go up too much. So that's one thing. Histaminem for any kind of allergic manifestation. So whether it's, the redness of the skin or a runny nose or a sneezy nose or a blocked nose, all of that, again, histamine acts as a very good remedy as well, even in the acute phases. So I would think of that. Pollen allergy. So pollen is again another remedy that I'll end up using if we feel like, okay, this person does have a pollen allergy. And so how will you differentiate between a pollen allergy and a dust allergy? So a pollen allergy will generally be worse when they're outdoors, whereas a dust allergy will generally be worse when they're indoors.
Indoors.
Yes. So, so again, that becomes a very good nosode prescription that I would end up using. Yeah.
Also, like in between, just bridging between the two constitutionals, I feel important remedies. What comes to my mind is we use a lot of dalkamara because a lot of respiratory and skin symptoms will be covered, especially when it comes to allergens, or being exposed to your allergens and coming with all these acute episodes. And something which is again very similar to this is iodine. And one which very important remedy which was taught to us by sir was penicillin, because usually when these patients come to us, they are heavily loaded with medicines. They're so much loaded. And in the old times when there were a lot of penicillin being used, the penicillin was actually used in this way. So he used to say कि जब इतने long time के बाद patient आएगा where already बहुत कुछ दवाई दे दिया है उसको, तो you don't directly fire up with a तुम लोग का नोबल आइडिया के साथ कि नो माई आई एम द होम्योपैथ एंड मैं तो कॉन्स्टिट्यूशनल प्रिस्क्राइबिंग कर दूंगा और ये वो, सर बोलते थे इनिशियली गिव पेनिसिलिन, वेट फॉर सम डेज and then let the original symptoms come out. Then that will be much like it will be a filter kind of a thing. So penicillin in such cases where the patients have already been heavily fired with a lot of antibiotics and anti-allergens.
I agree.
So
And one more use of penicillin actually, which
yes.
I read have somewhere,
Mm-hmm.
which is actually very handy
Yes.
to have, is in flights.
Yeah.
You know, a lot of people who will be like, after they travel in a flight, they fall sick. And
Mm-hmm.
I had read from one of the authors that penicillin is actually a good prophylactic for that. And so I've started even using it for myself and my family.
Oh.
I carry a little bottle of pills every time I'm flying, and I'll have a few pills before the flight, a little bit during the flight, and maybe for another dose, after the flight's done. And I really noticed a difference that, the runny nose, that whole, nose block that you
Mm-hmm.
get from the air cons, from the air circulating in the flights and
Mm-hmm.
things like that really kind of work. So again, I feel like it's a good remedy to have on hand for those purposes as well.
Great.
Yeah.
Okay. So next is can we talk a little bit about the gut, the diarrheas, the stomach upsets, maybe when they are put on top feeds from mother's lactation to top feeds, and maybe how they are developing their gut. So what can be
Um,
really thought during that time?
okay. So one more thing I actually even forgot to mention during when we
Mm-hmm.
discussed TCC was bowel nosodes. And so
Ah.
you mentioned gut right now, and I thought of it that bowel nosodes also is something that I'll end up using quite often.
Mm-hmm.
Especially when we talk about allergies, and maybe we can discuss this when we talk about the skin. But
Mm-hmm.
Morgenbach becomes, again, a very important remedy that I'll end up using for that.
Mm-hmm.
Of course, the other bowel nosodes as well, I'll end up using quite often. Uh, Another great remedy that I've recently started using is colostrum. So we all know what colostrum is, right? The first milk. And so there is a remedy in homeopathy also that gets made from that. And
Mm-hmm.
what I use is the 8x potency. So it comes as a powder. And
Okay.
so I give, kids a little bit just to keep it, the parents
Mm-hmm.
keep a little bit with them. And just a
Mm-hmm.
few pinch from that, bottle every day. This acts like a very good immune support and helps build up the gut, especially for kids, who weren't able to do breastfeeding in those first few days of life. Kids who were, maybe taken into the, NICU, or the mother
Mm-hmm.
could not, kind of lactate, and, she wasn't able to in the first few days, and the kid was primarily dependent on formula. I feel like colostrum becomes a good immune support also, and a gut support as well. So irrespective, I feel like if there's gut issues in general, like colic and things like that with kids, colostrum becomes a good support for these kids.
Mm-hmm.
So I would
Great.
definitely use that.
Definitely. It's one of the very nice remedies.
Yeah. And then, of course, your regular, your colocynth and your. So I also like to use a lot of chininum as for
Mm-hmm.
diarrhea. A lot of
Mm.
Nux vomica. I think in the clinic we used to use a lot of Nux vomica
Yes,
and
yes.
potency for diarrhea.
Diarrhea.
So yes. So I would
For
land up
diarrhea,
with
we,
those
we
remedies.
diarrhea, we used to always, I remember we used to differentiate it very well. Trombidium, Nux vomica,
Gambogia.
Podophyllum, Gambogia. So these were
Gambogia.
the four main armors
Yeah,
of diarrhea. And
exactly.
obviously, colostrum has typical, like what we mentioned, has typical green watery mucus diarrhea, which is especially present in the very initial stage, and helps in developing the gut.
Yes.
So, any other gastric complaints that are very common in pediatrics, like apart from this, like
So I feel like colic is of course something that we all
mhm,
must
know
address
about
and
it.
know of, yes. And again, a lot of simple remedies will come up, even when you repertorize the case, like your lycopodium, your carbo veg, is
Yeah.
stuck gas that's causing this child some discomfort, whether it be MAC-FOS. Remedies
McFoss.
like that, yes, will keep coming up pretty often, and they help very
Mm,
well, especially
mm.
if those modalities of those particular remedies are present.
Drugs
I
are
feel
matching.
like, yeah. So those remedies will definitely work
Mm,
in, and generally, I feel like with tummy complaints, it could, of course, be psychosomatic with a lot of children, especially when
mm,
it's, simply functional. There's no other symptom present. One
mm,
thing you should consider, of course, is constipation, because
mm,
constipation could lead to, tummy pain with kids, and if they're not kind of evacuating their bowels out too well. And so in those cases, think of remedies that could help, specifically with that. And so a lot of home remedies is also something I feel like we should include, especially when we're working with
Hmm.
any kind of gastric complaints. Like, ask the child to have more ghee or more
Hmm.
coconut oil, make sure the system is lubricated. Kids are not
Hmm.
used to
Hmm.
having a lot of vegetables. So, of course, the fiber content is going to be a little low. So try to, advise them which fruits
Hmm.
they could probably introduce and things like that, to make sure that the diet is also favoring that.
Hmm. Hmm.
And if there is pain because of constipation, the remedy that you could probably even think of is bacillinum.
Hmm. Hmm.
So,
Okay.
the pain caused because of constipation in children, you could think of that remedy as well.
Okay. Okay. And
Yeah.
next topic, I think, is there anything specific? Just finishing the last thing that you mentioned, functional abdominal pain is something which is coming up very commonly. But again, going with Macphos and Colocin or whatever the modality matches, I think that would be the best thing to do in the functional abdominal pain also, no?
Yes, yes, yes. So when you say functional abdominal pain, you mean which is not pathological, right? So there's no known
Hmm.
cause for it. It's
Hmm.
just
Hmm. Hmm.
yes, correct. So kids will do that all the time, especially when they don't want to go to school, or they don't want to wake up in the morning and things like that. You will get a lot of that. And you probably just have to, somewhere in that case, develop a little bit of a skill to understand whether it's
Hmm.
actually something, or it's just, more, as I said, psychosomatic.
Hmm. Hmm.
Yeah.
Then touching the next part would be growth and development. This is something which is a main concern. Like a lot of parents come with के इसका वजन बढ़ा दो, इसकी height बढ़ा दो, उसका ये करा दो, वो करा दो, and then we again tell them that like what we said in के कराना कुछ नहीं होता है, करना तो सब parents को ही पड़ता है, but it's just the way that as with the medicines we need to educate them that. But can we really have something for growth and development? Like, is that
So
something a concern?
I feel like, again, if we go and study the case, and again, there are remedies, right, in rubrics, like eats well, but still does not put on weight,
Hmm.
or
Hmm. Hmm.
a lean constitution, things like
Hmm.
that. And so we could probably think of the remedies that come across under those rubrics as well. But
Hmm.
I think in general, the main criteria that we physicians
Hmm.
need to kind of educate the parents on is that if your child is active, if your child
Hmm.
is growing well in terms of the milestones are all kind of more or less on point and things like that, there's really no need to be concerned about the weight as such.
Hmm.
A lot of parents will come and tell you and talk, about the percentile. So, for example, the percentile that your child is born in is generally more or less the percentile that you follow, in their growth
Hmm.
curve.
Hmm.
Some of them will tend to fall in that, in which case you probably need to be a little more alert with this child and just make sure that, you're not missing something or skipping something, and make sure your examinations and everything are correct. And, this child does not grow up to have any kind of future abnormalities. But other than that, I feel like if it's only weight and height that's a
Hmm.
concern,
Hmm.
there's really nothing at all, that parents need to worry too much about.
Hmm.
But of course, we have remedies, right? Like Bufo that we could
Hmm.
probably think of. We have remedies like Baraita that we would probably think of.
Hmm.
And of course, a lot of the other constitutionals I'm not going to talk about. But besides that, we have a lot of these, specific, or we have use a lot of this alpha alpha tonic
Ah.
and things like that, right? Which generally homeopaths will tend to give. I
Hmm.
personally don't use alpha alpha, but I know that homeopaths do land up,
Hmm.
using a
Hmm.
lot of this, just
Yeah. Yes. Yes.
as a support, to give
Yeah.
along
Yeah.
with everything else that they're giving.
Sometimes the problem is like if even if you don't want to prescribe alpha alpha or any of such tonics, like we are so much under the pressure.
Correct.
I like say because they'll say that कुछ बाहर से लिख के दो कुछ बाहर से लिख दो then you feel like if I write Activate or if I write a syrup A to Z, rather I'll give an alpha alpha, at least I'll do something when my pathy. Why to let them
Correct.
go into the
Correct.
other side of the medicine.
Correct.
But
Correct.
just one, like what you said is absolutely correct. Remedies like calcarea phos, silicia, baraita carbs, and everything will be covered. One very important remedy which I feel like I should highlight here is anterior pituitary, like which when in genuine cases where the growth and development mental may be mental or physical is affected, Like we have had the best of the users. We have used from 30 to 10 and when we have seen wonderful results. And sometimes even in the cases where there is development is arrested, in the classical case of epilepsy, you're using calcarea, and you have some kind of a backlog. Things are not getting cleared up. I think anterior pituitary, obviously we have anterior pituitary, posterior pituitary, and the pituitary glandula, three parts. But I think most of the times, like when we are talking about growth and development, we'll just focus on anterior pituitary, and it really gives wonderful results.
Correct. I agree with this, and this is also, one of the very many remedies I feel like which become quite useful to keep with you. A lot of these hormone remedies, or a lot of
Yes.
these, things. Another one that you could probably even again think of, and now because you mentioned it, was some remedies like placenta.
Yeah.
Remedies that are actually a part of the development of a child while they're growing up, or like lacumenum or placenta, or the umbilicus, and remedies like that also become quite important
Yeah.
to know. Yeah.
Then next topic. Pica, we'll take pica.
Okay, let's do that.
Like pica, like is it specific? Do we give something specifically for pica apart from correcting iron deficiency, or the different
So that's
nutritional?
exactly what I was going to come to. I feel like for this, it becomes very important to open up the whole topic towards the supplementation, right? Because
Hmm.
as homeopaths, I feel like some homeopaths are still against it. Maybe
Hmm.
not the younger generation ones, but
Hmm.
I feel like there are still a lot of older guys who would probably feel like it's not the best idea to do both together.
Hmm.
I
Hmm.
personally, in my opinion, I'm 100% for any kind of supplementation. And the reason is that because I feel like the day and age we live in is not the same as it was 50
Hmm.
years ago, right? So
Exactly.
even though we're all eating the same food and we're eating the same vegetables, the nutritional value of it is extremely poor. The pesticides in it are intense, the glyphosate and everything that we're consuming along with it, which isn't allowing for proper absorption of the vitamins and minerals. And so it is a fact that we're all lacking severely in it in some
Hmm.
form or the other. And for example, now even Pika, right? So they have
Hmm.
seen that, if it is an iron deficient mother through
Hmm.
pregnancy, the child born to that mother is going to, land up having some of the other symptoms around these abnormal cravings that they will develop. And so
Hmm.
simple things like iron supplementation it becomes essential. And honestly, I have a lot of cases of anemia out here.
Hmm.
And you will want to give your constitutional, you will give your ferrum phos 6x, and a lot of remedies around it. I have these iron tonic bottles and this and that, and the homeopathic ones. But I feel
Hmm.
like they still don't do the job 100%, like how an iron tablet or a supplement will, or
Hmm.
with that kind of quickness and intensity. So I feel like supplementation does become important. Even zinc. I mean, most
Hmm.
of the kids are deficient in zinc, which again leads to a low immune system as well. So even when we're working with TCC or allergies and things like that, simple zinc supplementation actually changes the case a lot and actually lands up improving this child much faster. So I feel like when you're dealing with any kind of health complaint, it's nice to work at it from all different angles. If you want to do homeopathy, we do homeopathy, we do supplementation, we do good lifestyle, we do good nutrition. And I feel like when everything comes together, the results are so much more appreciated.
Exactly.
Yeah.
But are there any specific, like you really opened a good topic that we really don't focus a lot on supplementation. So like if you had to give just in short, if you had to just educate us, because even I'll accept that even I'm not very good at advising supplementation, but just as a basic guide, if you could give, just highlight that from like few from 0 to 5 years of age group, what are the supplements that we should really focus on as homeopaths?
Sure. So I feel like vitamin D is very
Hmm.
important. Again, this vitamin D is span all age groups. There have been
Hmm.
a million studies which have shown that if you have optimal levels of vitamin
Hmm.
D, you land up preventing a lot of diseases, starting all the way, from allergies and ending all the way in cancer. So I feel like vitamin D becomes very, very important to supplement with. Now, again, with supplements, it's tricky because it's what kind of supplements to give as well, right? Because you have a supplement for 10 rupees and you'll have that same supplement for 1,000 rupees.
Hmm.
So again, I feel like as homeopaths, it's nice to do a little research as to what
Hmm.
form of vitamin D again is the most bioavailable to you. So most of the times what happens is supplement goes in from your mouth and comes out from your poop and your body is not absorbing anything at all. And so again, that becomes a waste of money. So with vitamin D, for example, now we know that it is fat soluble. So you want to
Hmm.
make sure that the vitamin D that you're having comes with
Hmm.
some form of fat. So the ones that I like to recommend come in an oil base and it comes
Hmm.
as drops. So you
Hmm.
then take those, drops directly onto your tongue, and then, the body is able to absorb that much better as
Hmm.
compared to any other form.
Hmm.
Then another one is zinc. So zinc again for 0 to 5 becomes a very important vitamin to have. Uh, Along with that, I do also advise herbs. So if I feel like there are particular herbs that I am very fond of, and I am very fond of a lot of these, so not only in the homeopathic form, but sometimes even in just the herbal extract. So for example, herbs like astragalus, like echinacea, like
Hmm.
elderberry, things like that, I like to even give in the herbal form. And so there are
Hmm.
certain supplements that will combine this. So for example, there's a very nice supplement that we have here called Sambucol, which is a mix of your elderberry, which is your sambucus. It's a mix of, it's got zinc inside, it's got vitamin C inside. And so it becomes a really nice mix to work on a child when you're trying to prevent, and boost up this child's immunity and make sure this child is not falling sick so often. And again, vitamin C and zinc as a combination is a very good supplement that kids must be
Hmm.
having.
Hmm.
Other than that, iron, I feel like only if required. I would not recommend it to everyone. But if you have a history of, iron deficiency, and recently it's actually been diagnosed more and more. So
Hmm.
if you feel like that is the case symptomatically, you could start off with some form of iron syrup as well. But I feel like that's it. I wouldn't do too much. I wouldn't be
Okay.
someone who says, start with this also and that also, and,
Hmm. Hmm.
probiotics
Hmm.
also and magnesium also. So magnesium is something I do advise every now and then when the child is constipated. So
Hmm.
there are
Hmm.
very nice magnesium supplements for kids that are now available. And it
Okay.
just kind of helps ease out, that gastric discomfort. So I will advise that. But no,
Hmm.
other than that, not too much.
Not too much. No, that is really good because this I personally take this as an advice for me only because I don't know much of it, and maybe it will really help handling cases.
Yeah.
Next, I want to touch the topic which is your forte, which you have really studied a lot. Like I think, and I think nowadays it is very common that people will come out with this expertise, that expertise, and the new expertise where everybody wants to brand themselves as autism. Like they are managing autism, they are curing autism, they are doing this with autism, that with autism. So please, you've done your PhD in autism. Nobody knows better. Nobody has read autism as much as you in people whom I know. So could you please share your insights on basically how a homeopath should look at autism, how far we can go to treat it, and if there are any protocols that you have really read and which are really effective.
Okay. So I feel like, I mean, it's a huge topic. So I won't go into too much detail, but maybe just cover the very
Yeah,
basic, just to kind of keep
basics.
it a little interesting. Yeah. So autism, I feel like, again, as you know, how you started working with dad, I started working with Dr. Anita, who was a
Yeah.
pediatric neurologist. And I feel like sitting in her clinic really motivated me with the just sheer number of cases that were coming in of these developmental delays of autism. And I feel like it was at that brink, when people knew about autism but still didn't know enough about it to really be able to do anything about it. And I think with homeopathy, I only knew of Dr. Barvalia, who was,
Hmm.
kind of doing, research and, good work around it or had a center around it at that point of time. And a few people were just starting off, kind of touching it, but it wasn't really super massive at that point of time. But I feel like even from that time that I started it to now, everything has changed because
Hmm.
we now know so much more medically about what autism is and why it's happening. at first we had no clue, right? So some people were like, oh, it's genetic, and that's why it's happening. Some people were like, oh, some genes are missing. Oh, it's because of the mother's, bad history during pregnancy. And we actually honestly had no clue about what was causing it. A lot of the community, of course, believed that, it was the vaccines that were triggering it off and, causing those symptoms. But then again, a lot of the kids who weren't vaccinated were also getting autism. And so it was a lot of mixed kind of inputs regarding it. I feel like if I were to explain what it is right now at this point of time, I feel like it's one of those conditions. Of course, now we don't say autism, we call it autism spectrum, because you have to imagine it like a whole, rainbow spectrum, where one kid could be on one end and another kid could be on absolute other end. And you see that all the time, where one autistic kid, will be hyperactive and, touching everything in your clinic and destroying everything. And the other kid is completely on the other side, where reserved, does their own thing, has great, attention and focus, can manage to do one activity. For example, if it's playing a piano, they'll be master in playing the piano and have absolute skill in it. So there's a lot of different varieties now which all lie under the same spectrum of autism. And I feel like if we were to treat it, we cannot treat it in a very isolated manner. So I feel like with autism, you need a lot of different modalities that come into play when you're working on it. And of course, being homeopaths, the skill that we should display is treating it with homeopathy. But along with that, I feel like therapy plays a very, very big role. So I would endorse, anyone who's working with autism to not ignore that and not feel like, homeopathy can do everything, because honestly, we can't. There is a huge factor that, for example, occupational therapy, speech therapy, behavior therapy play in it, which homeopathic remedies, unfortunately, will not be able to only provide for. So that's one aspect. Another aspect which now they have realized is that the gut of an autistic child.
Have a sip of water, please, Rukshin, I request. I know this topic is your favorite topic. It is going to bring a lot of adrenaline rush, but please keep sipping water. I don't want at the end of the session, I get a message from sir कि तेरे सेशन की वजह से मेरी बेटी का गला खराब कर दिया तूने.
Yeah. So they analyzed the gut of the autistic children, and this was a huge study that was again done. And what they realized is that there are certain strains of bacteria that are absolutely missing from these children. And this was quite a contrast study that showed that they were absolutely missing. So none of the autistic children had it, and most of the normal children had it. So they figured that there was something to do with these strains that was probably, kind of disrupting the gut with these children, and maybe not causing autism, but definitely contributing to the autistic symptoms that were coming across. So I feel like, again, gut support, gut work is very, very important when you're working with these children. Now, when I say gut work, there's a lot of different aspects which come into it. One of it, of course, is, replenishing the gut. So currently, even besides autism, all of us are functioning with a 10% of the microbiome that our ancestors had. So we're all 90% deficient in just the normal good bacteria that we all should be having. And then again, that's also because of our exposure to food and toxins and things like that. So now I feel like working on that becomes a very important aspect. Secondly, a lot of the kids with autism cannot detox a lot of the things that they're exposed to so well. So for example, when me and you come into exposure of whatever chemicals that we're surrounded by, whatever chemicals that we're inhaling, putting on our skin system, all of that, our livers are able to process it. Our kidneys are able to process it. It gets eliminated. But these kids cannot. And so it lands up sticking around, in the system and causing these symptoms with these kids. So that whole detox pathway needs to be worked on so that the elimination gets better. So that's another aspect of, kind of working with autism. So nutritionally, for example, now they did a lot of studies where they saw that kids who were put off gluten, put off sugar, put off dairy, did much, much better in recovering as compared to kids who were still on all of these food substances. So we know that, there's a lot of these different factors which are impacting these kids, right? So I feel like working and knowing about all of these aspects becomes very, very important when you're working with autism. Because I can't say take carcinosin 33 times a day for, 6 months and expect this child to get better now.
No.
Now that I know more, it's my duty to first, of course, learn the research, understand the research, and then apply it and use it on my patients. That, okay, you know what, we can actually do this as well. We can actually supplement with this as well. We can actually detox you with this as well. And so all of this becomes very important when we're, trying to treat it.
Mm-hmm. Yeah, I understand, and I just wanted you to highlight to all our friends that how culmination of everything is going to be a very important thing while you're
Correct.
trying to handle cases of ASD. Uh, are there any group of drugs? Are there any special drugs that you have found out have really been effective during your PhD research or your practice? That because now, as I said, it's a fashion, it's a trend to bring out a lot of protocols. I don't really, we have never spoken about any protocols in any of our sessions, but we all have our favorites, some kind of where we tend to incline a lot. So I think the screen is
Oh,
freezing.
sorry. Yes.
Yeah, yeah, no problem. I think it's just that if you were able to hear me,
Yes.
that
No, no, I
so
could hear you. Yes.
are there any remedies which you have really maybe from your practice or more, maybe what you can say from Sir's perspective, are there any remedies that are really helping, which people should read, go home, read, and really learn from them?
So, see, again, with this, there are so many different schools of thought in terms of how to treat autism. So, for example, Dennis Smith, right? He came up
Yeah,
with,
yeah.
yeah, with the whole protocol, where basically he felt that there was something that, kind of was the ailments from for
Hmm,
causing these kids to have autism. And so it was very important to detox that, whether it was
hmm,
vaccines, whether it was a heavy metal, whatever it was, to kind of eliminate that before starting off with that kind of a treatment.
hmm,
Then now
hmm, hmm.
there is another school of thought of Tom Jansen, right? So where he has a
Huh.
lot of these protocols that he uses, where whether it's polyvaccine, whether it's polyantibiotic, or
Hmm,
remedies like that, which again become an important protocol to follow. I feel like with me, because even through my study, I started with doing constitutional prescribing. For
hmm,
me,
hmm,
that still remains one of the primary footholds in how I work with autism. But I remember meeting Dr. Heiner Fry once, who has
hmm,
also done
hmm.
work in autism. And the thing that he recommends is to follow the polarity analysis. And so he has
Analysis.
a separate kind of worksheet that he uses
Hmm,
for autism. And he feels that simply following, that protocol
hmm,
leads to much better prescriptions, only because it kind of eliminates a lot of the contradictory remedies.
hmm,
So,
hmm,
polarity analysis again, kind of becomes another modality that you could follow.
hmm,
Dr. Barvalia, of course, he groups his remedies, into
hmm,
hyperactive cases, remedies like your tuberculinum or phosphorus and remedies like that, or the kids that are, more slower and more
hmm,
developmentally arrested, like your Baritaka, Bufo remedies like that. So he's
hmm,
kind of segregated it into these different groups. For me, I like to repertorize. I
hmm,
like to eliminate the symptoms that you would most likely see with autism, stick to just the PQRS symptoms of the case, and then use that to
hmm.
prescribe.
Okay, okay. But like what you said about Tinner Smith in Tinner Smith, and are there any remedies which are like highlighted too much? Because these days we hear a lot that maybe halogen group of remedies will help a lot, or maybe helium, the first where there is a lot of dependency is required. So that kind of remedies. You really feel that this thing will this kind of theory falling onto these theories is going to help? Like I'm just curious to know. I'm asking from a very student perspective, I'm asking.
So honestly, I'll tell you what, I only like to speak if I have myself kind of done it.
Hmm.
And because I've not done it, I wouldn't
Okay.
just,
Yeah,
dismiss someone and something.
exactly, exactly.
Because I feel like, honestly, there's so many people who've improved from a lot of remedies like this as well. Maybe they
Hmm.
do, maybe they don't. I don't know.
Hmm. Hmm.
But
Hmm.
personally, I have not yet, kind of dipped my hands into getting these remedies. I will admit that I have been trying with Tommy Anson's
Hmm.
method. So I do
Okay.
use now a lot of these remedies that he's kind of advocating for, just to
Hmm.
understand and see for myself, if it's working well or not working too well. Like polycontraceptive is something I've been kind of trying to see, on my patients who've been taking OC pills for very long.
Okay.
So things like that. But I feel like I still don't know have enough number of people who are improving to really be certain of if it's working or not.
Mhm.
Yeah.
Okay. Okay. Last part before we sign off for the session. What remedies would you suggest for hand, foot, mouth? Because even that is very common.
Okay, lovely. Yes, so hand, foot, mouth is again something which you will see in your practice very, very
Yeah.
often.
Yes.
And there are two different kinds of things, right? So one mother will ask you for the child who's suffering from it, and the other she'll ask you that what do I give my other kids in the house who, to make sure that they don't kind of land up getting it. So I feel like remedies, of course, like your apis, rustox, remedies which have effect on the mucous membrane, developing these kind of red eruptions, ulcerations, your Merck Sol, your Merck Vivax. Remedies like that will generally land up coming up very well on repertorization, belladonna, and such. I feel like if preventively, you could probably think of a remedy like Rustox. Preventively, of course, if there are no constitutional treatment, excellent. That's going to be the best
Mm-hmm.
form of protection for them.
Mm-hmm.
But yeah, I think if I were to say Apis, Belladonna, Merxol, those would be the
Mm-hmm.
top few remedies that I would probably think of.
Okay. Okay. Great. So that was a good time with you, Rukshin. In spite of bad health, first thanking you once again for sparing your 1 hour, and it really means a lot that we just are a group of people who ultimately found each other very good to be with. And so thank you for joining us, enlightening us with your whatever you have studied, enlightening us with your education, and we really look forward to you when there is a good when because I want to do one more session for immunology, because you have a great interest in immunology. You've studied, that's what your Instagram handle also says, that it's immunity doctor. So I know you have a great interest in immunology. So maybe once again we'll take your appointment, and we'll try and figure out with how a homeopath should look at the chapter of immunology. What is important for us?
Surely. Thank you so much for having me. It was a lot of fun discussing a lot of this. And
Yes, so
glad that you're
just
doing this. I
yeah.
think it's good work calling all of these, different people with different kind of knowledges and areas of expertise to come and teach. So all the best to you too, and all the best for your new book, by the way.
Thank
Really
you.
excited to get my hands on that sometime.
No,
And
the
yes,
book is yet to come out. It's just a cover release that we have done. The book is in the
okay,
last leg. The book is in the last leg of its
super.
being done. And maybe because I thought it was a big day, and I thought it was a good chance to announce at least the cover. So we just released the cover page.
I'm so happy. I'm sure it'll be out by the time I come to Bombay next, maybe in July.
Yes,
So
yes,
I will
yes,
I will
definitely,
get my
definitely.
headset.
Yes, yes, yes. Thank you
Okay.
so much.
See
Yeah,
you.
bye bye.
Have a
Take
lovely
care. Take
evening.
care. Yeah, yeah,
Bye.
yeah.
Take care.
Bye.